Life after CRS HIPEC, recovery, nutrition, follow-up and long-term outlook. People prepare themselves mentally for the surgery, the hospital stay and the idea of HIPEC. But what most patients and families want to understand is much simpler. What will life look like afterwards? How long will the recovery take? When will I feel normal again? Hello, I am Dr. Anuj Suketu, GI Gynec Peritoneal Surface Oncosurgeon. I want to take you through the complete recovery journey after CRS and HIPEC, physically, emotionally, and practically. Let us begin with the immediate post-operative period. The first 24 hours to 48 hours are focused on monitoring. Patients are observed in the ICU because CRS and HIPEC affects the fluid balance, electrolytes, and temperature regulation. Pain control is a priority. Modern anesthesia methods and regional blocks allows us to keep patients comfortable and awake enough to engage in early recovery. On day 2 or 3, mobilization begins. Walking is not just symbolic. It helps prevent clot, improves breathing, and reactivates the digestive system. Patients often worry about eating after such a big surgery, but nutrition is reintroduced gradually. Initially liquids, then soft food, and slowly regularly meals. What most people do not realize is that recovery moves in layers. The skin heals first, the muscle regains strength, the energy levels come back, then appetite stabilizes. Each week brings a new improvement. By the third week, patient usually feels more independent. By the sixth week, many resume work in a partial capacity. And by the third month, life begins to feel normal again, with some adjustments. Now, let us talk about emotional recovery. It is normal to feel overwhelmed. CRS and HIPEC is a major surgery, and the journey can be mentally taxing. But understanding the roadmap and staying connected with your team helps immensely. Patients often feel anxious before scans or follow-ups. This is natural. Over time, confidence grows as the body heals. Nutrition plays a central role in recovery. Protein intake helps rebuild tissue. Hydration helps and supports kidney function. Small, frequent meals prevent bloating. Dietitians guide patients on food to avoid temporarily, such as very oily, very spicy dishes. Gradually, the digestive system adjusts. The patient returns to regular diet. Long-term follow-up is essential. Depending on the tumor type, we schedule CT scans, tumor markers, and clinical reviews every few months initially. Over time, these intervals increase. Follow-up is not about searching for problems. It is about ensuring that recovery stays on track, and any recurrence, if it happens, it is caught early when it is still treatable. Quality of life is the most important outcome. Most patients return to full activity, travel, work, and family life. They regain strength, confidence, and routine. To summarize, life after CRS and HIPEC is absolutely normal for most patients, but it requires patience, guidance, and structured follow-up. The surgery is big, yes, but the recovery is designed, predictable, and deeply supported. Your journey does not end at the operating room. It begins there with a plan, a team, and path forward.